Good day, fellow South Africans and citizens of the world. And the National Health Insurance Scheme, this other little Alice in Wonderland fantasy story that the ANC are playing with, just so they can rort some more pennies out of the system. Of course, the reason that they're trying to do this is because there's a private health insurance scheme which has actually got a bit of funding. And guess what they're going to try and do? Once they force that money into the National Health Insurance Scheme, it's going to be gone! Like everything else, straight into someone's back pocket. That's what it's all about, guys. You've got to understand. Just, follow the road. You can see where things go. All roads lead to Rome. Someone's back pocket at the ANC. And that's exactly what the NHI is all about. And while they're carrying on about doing this NHI, I have to tell you, the most terrible things are happening. I'm going to first of all read you an email I got, and I've put a video up about this particular family's problem in the past, but it is typical of what's happening to South Africans all over the country. All colours, all races. It just so happens this is a white South African. And he says, "Thank you for your reply. I wish I saw your video sooner. I would love to tell you more, but as Y, I'm not going to say what her name is, has not had her bipolar and depression medication now for 2 weeks." Now, what he's talking about is there's a shortage of this type of medication in South Africa. And of course, it's probably because someone has kind of siphoned it off and put it in their back pocket. And it's no longer available to the general public, who are supposed to be the recipients of such medicine if they have mental issues or mental problems. And D carries on by saying, "I'm looking to do many things to keep the roof over our heads, and Y medicated." Y apparently is his wife. "Spreading myself thin by starting a food blog, as I used to be a chef back in the day. 3D design and printing, and most importantly, keeping my job, which is customer support for an American company called," and I'm not going to say what the name is. Sorry, Secret Service in South Africa. No, you're not going to ever find out. "After persisting and doing all this work, I was fortunate to be contracted by a friend to assist with ongoing projects for the next year in whatever. Her husband also asked me to step and assist with vehicle modifications. This happened at the grace of God 2 hours after I sent this message to you. Thank you for your concern, and thanks for all the help you are providing to our people. You give us hope." And he says, "Keep up the good work." And of course, this is a long road that we're going to be working on together. So don't worry about that. And talking about the NHI and the fantasy of a national health insurance bill that's going to cure the elements of the whole of South Africa. What a load of poppycock. As Parliament prepares to start public hearings into the National Health Insurance, or NHI bill, the Democratic Alliance, now I don't particularly like the DA, but I think they've hit the nail on the head right here. The DA on Monday said the country was facing a looming nursing crisis. Now, they've got an incredible doctor crisis. All the doctors are flying out of South Africa. They're just falling over themselves to get out because of the NHI. And now the nurses are apparently following suit. The DA said that in its hurried attempt to implement NHI, government stalled the process of accrediting new and current nurse training institutions, which would be critical to the rollout of the NHI. Chairperson of the Health Portfolio Committee, Sibongiseni Delomo, said that an official communication was sent to all political parties represented in the National Assembly. informing them of countrywide public hearings on the NHI bill, which would begin in October. But the DA said a lot still needed to be done with regards to nursing before NHI could be implemented. But this is typical ANC. You put the cart before the horse, and when the cart just rolls off down the edge of a slope and crashes and loses a wheel here and loses a wheel there and runs out of money there and nothing happens here and turnaround can't happen because there are no wheels left on the wagon, you know what? It's par for the course. This is the ANC government in action. But the DA said a lot still needed to be done with regards to nursing before NHI could be implemented. DA MP Madeleine Hicklin said that without trained nurses, clinics and hospitals, it would not run effectively. Now let's remember that the Clinton Foundation are one of the major drivers behind this universal health care. And they are supported by one George Soros of the Open Society Foundation. So you can start seeing all the bits and pieces starting to stick together. The whole thing is a complete scam. Anyway, she said, with the introduction of the NHI in 2025, you will not be able to have a staff complement able to look after the patients we currently have, much less the patients who are going to be joining the NHI. Hicklin said projections were that there would be a nursing deficit of 400,000. Yeah, you heard me right, nearly 500,000 nurses in South Africa by 2025, when NHI was expected to be fully in place. And you know what you're going to have being a nurse? You're going to have one of these people who's coming through the matric, only achieving just 30% to get a matric pass. Then they've been hurried off to a little nursing school where maybe they do the old witch doctor stuff as well. I mean, who knows? I mean, it's in South Africa. You can't make this shit up. But witch doctors, sangomas, the ones who roll the bones, who take human body parts and make muti out of it, you know, a lot of that sort of crossover are now being involved and incorporated into the National Health Insurance Scheme in South Africa. And I'm not kidding you. This is serious. We're not talking about qualified Western doctors. We're talking about witch doctors that are going to be treating people as if they are qualified medical practitioners. This is a complete scam. But that's how they'll get around the problem. They'll just say, this is Africa. You know, we don't mind if they don't really do what they're supposed to do. It's just Africa. As I said, you can't make this shit up. Anyway, getting back to what this lady said. Hicklin said, we are currently sitting on a ratio of 1 nurse to 1,000 patients in your worst case scenario. Hicklin added the DA would make a submission once the hearing started. Now, why am I not surprised? Why is anybody who watches my channel even faintly surprised at the complete disorder, the complete lack of sense, the complete lack of L, the old L factor, the logic factor? This is typical of what is going on in South Africa today. It's why every state-owned enterprise is bankrupt. It's why every single ANC government ministry is corrupt. From the very top all the way down to the very bottom. They're all on the take. Every single one of them. I would love to find an exception. And that is why things like the Zondo Commission are just a load of hot air, and none of these politicians or bureaucrats will be charged, even if they are found clearly guilty of corruption. But if you're that little guy, like that person down in KwaZulu-Natal, Durban, who stole from the ANC government, bing, pull the clangers on, 5 years behind bars, just like that. Yeah. That's justice in South Africa. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video, and above all, be safe. Bye for now.